Keto diet is one of the most popular diets for weight loss, and only known mechanism for weight loss is ketotic state. Ketotic state means when our body uses fats to produce ketones, and ketones are used for energy production. That's the idea of ketosis. And ketosis causes weight loss. Ketosis causes fat burning. So, how to understand that we are in ketosis? What is signs of ketotic states? First is increased thirst. Increased thirst is not universal symptom, of course, of ketotic state, but it is most frequent symptom, most frequent sign people describe. And what's the underlying mechanism? This increased thirst. Fats converted to ketone bodies, and some ketones are excreted from urine, and urine volume increases, and fluid loss increases, and compensatory mechanism is increased thirst. So increased thirst is first and most important symptom of ketotic state. But again, in some people there is no increased thirst, and it's also normal. Another important symptom is bad breath. Why bad breath? Because from fat ketones are created, and these ketones are three types of ketones. First is acetoacetate, second is beta hydroxybutyrate, and third is acetone. And acetone is excreted by breath. That's why when person is in ketotic state, he or she has bad breath. Sometimes it can be sweety or fruity, so it's not essentially bad breath, but it's different taste anyway. So many cases it's bad breath also. And here is also a question that ketosis, if ketosis changes our acidity into our mouth. Yes, slightly. Generally, our oral pH is neutral. It's around 7. But during ketotic state, it becomes more acidic. So our pH is lower during ketotic state, and it further increases bacteria which can cause bad breath. That's why here these two mechanisms why ketotic state can promote bad breath. Also, this two is most important: increased thirst and bad breath. There are several other symptoms, but sometimes they are presented, sometimes not. But most important and most frequent are these two. Third sign is decreased appetite. And why ketotic state causes decreased appetite? Because ketones affect hormones which are secreted by GI tract. It's leptin and ghrelin secreted by our stomach, gastric, and it increases level of leptin and decreases hunger hormone, which is called ghrelin. And leptin is called satiety hormone, so it increases satiety level and decrease hunger. So ketones decrease appetite. That's also important feature. Other signs and symptoms include headache, nausea, vomiting sometimes weakness, fatigue, but these symptoms will go away as we adapt ketotic states. And how medically we can measure keto if we are in ketotic state? We have three types of tests. First is ketone strip test, is urine based test, and it measures acetoacetate into urine. It's byproduct of ketone production. So and acetoacetate is excreted by urine, but here problem is that if person is in ketotic state for several days or several weeks, maybe acetoacetate level can be lower. So it's not very precise test. And also it depends on hydration. For example, if person drinks lots of water, acetoacetate concentration in the urine can be low. So it can be considered as useful test, but not very accurate. Another and most accurate is considered blood ketones meter. Blood ketones meter measures beta hydroxybutyrate, which is called BHB, and it finger pricks, and you should get some blood from your fingers, and it measures, and it is considered most accurate. But for some people, such mechanisms are traumatic. It's like glucometer. Everyone knows glucometer, right? So it's very looks like glucometer, but it's most accurate. And third test is breath ketone meter. Breath ketone meter measures acetone level in the breath. It is considered second most reliable test. Because it's not accurate as a blood ketones meter, but more accurate than urine ketone test strips. So it's also important, and it's not invasive, less invasive method. So anyone can use. Now let's summarize. If you want to buy any tests for your ketosis, you have three choices. One is urine test, second is blood ketone meters, and third is breath ketone meters. Most less invasive and accurate at the same time it's breath ketone meter. Most accurate is blood test, and less accurate is urine test. And how we spot that we are in ketosis without medical devices? What I say personally is bad breath. If person has bad breath and acetone smell, he is or she is on ketosis, in ketotic state. So of course bad breath can be many other factors, so it's not guaranteed that person has bad smell, but bad smell, and it automatically does not mean that he or she in ketosis. But if person is on keto diet or fasting or intermittent fasting, and he or she has acetone smell in the breath, it means he or she is in ketosis. Thank you very much. I'm Gautam. If you like my videos, please subscribe and like videos. It's huge motivation for me. Thank you very much. Bye for now.